Restrictive cardiomyopathy. Etiology, pathophysiology, and pathology. This is a chronic progressive condition characterized by excessively rigid ventricular walls that impair ventricular filling, diastolic dysfunction. Contractile, systolic, function is preserved. Causes are divided into myocardial, e.g. amyloid, sarcoid and storage diseases, often idiopathic. Endomyocardial, e.g. endomyocardial fibrosis and hypereosinophilic syndrome. Epidemiology. This condition is rare in Western countries. Endomyocardial fibrosis is common in the tropics, particularly in Africa. Clinical presentation. Symptoms: breathlessness, fatigue, ankle swelling. Signs: elevated JVP, which rises on inspiration, Kussmaul's sign. Third and or fourth heart sound. Peripheral edema. Ascites. Investigations. Chest radiograph. The heart size may be normal or increased. Pericardial calcification suggests constrictive pericarditis rather than restrictive cardiomyopathy. Echocardiography. Ventricular cavities are usually not dilated, but atrial cavities are often greatly enlarged. Rapid ventricular filling may be seen at the onset of diastole, which stops abruptly in early diastole. Cardiac catheterization may be diagnostic in restrictive cardiomyopathy. Rapid ventricular filling in early diastole produces a square root sign appearance of the left ventricular diastolic pressure trace, which is also seen in pericardial constriction. However, other catheter data help differentiate the two conditions. Table 26. Myocardial biopsy. Biopsy is sometimes useful to identify the cause of a restrictive cardiomyopathy. Differential diagnosis. Restrictive cardiomyopathy must be distinguished from pericardial constriction, which is readily treated by surgery. Table 26 gives distinguishing features, but in up to 25% of patients it is not possible to differentiate the two conditions, and in these circumstances exploratory surgery may be justified. Treatment. The response of patients to medical treatment of heart failure is often poor. Successful combined heart and liver transplantation has been described in amyloid cardiomyopathy. Prognosis. The disease is generally relentlessly progressive with a high mortality.